Welcome, my student. Let's get started. Today we will be diving into Chapter 2, Part 1, which asks a very important question. Why is public health controversial? We will explore the friction between individual rights, economic realities, and collective well being of society. Before we get into the main theories, let's look at the key terms we will encounter. These terms form the vocabulary of our discussion today and the next lecture also. Economic impact, individual liberty, libertarian, moralism, paternalism, political, political interference with science, and the tragedy of the commons. To understand why public health causes controversy, we first need to define its mission. So, the broad mission of public health. The Institute of Medicine defined the mission of public health very broadly in its report. The future of public health as fulfilling society's interest in assuring conditions in which people can be healthy. Because this definition is so broad, these conditions include many factors that might not normally be perceived as relevant to public health. For example, the most significant factor determining a community's health is actually its economic status. Studies consistently show that people with higher income tend to be healthier for a variety of reasons. This broad, encompassing definition might seem like a modern concept, but it actually has deep historical roots. Historical perspective. This expansive view is not new at all. Winslow, 80 years old, definition the definition of the scientist Winslow specifically included developing the social machinery needed to ensure an adequate standard of living to maintain health. Indeed, the early history of the United States public health was closely tied to social reform movements. 19th century reform reformers campaigned not just for sanitary science and public hygiene, but for improved housing, trade unions, uh, the abolition of child labor, maternal and child health, and temperance. Moving from historical campaigns to modern philosophy. How do we conceptualize this field today? Public health as social movement. Again, Winslow thought of public health almost like a military campaign, writing about whole populations mobilized for a great war against preventable disease. Truly, public health can be viewed as a broad social movement. The scientist Dan Beauchamp, noted public health philosopher, argued that public health should be a way of doing justice and asserting the value and the priority of all human life. In an influential 1974 paper, he called on the field to actively challenge the prevailing United States ideology, which he dubbed market justice. Let's break down this ideological conflict between market justice and social justice. Market justice versus social justice. Beauchamp, the scientist Beauchamp noted that market justice emphasizes individual responsibility, minimal obligation to the common good, and fundamental freedom to be left alone. Under this ideology, the powerful forces like the environment, hereditary, and social structure actually prevent a fair distribution of societal burdens and benefits. In contrast, social justice suggests that basic needs like minimum income, basic housing, employment, education, and healthcare should be seen as fundamental rights. He stated that the historic dream of minimizing preventable death and disability is essentially a dream of social justice. Naturally, this social justice framework faces significant political pushback in the United States. Political resistance to broad public health. Political conservatives have tended to resist this broad vision of public health. Many prefer limiting it to technical enterprise focused strictly on controlling communicable diseases or just providing a safety net of medical care for the indigent. Historically, this restricted view was encouraged by physicians who were concerned about government encroachment on their economic and professional independence. In fact, their political power in the 1930s and 1940s successfully limited federal health funding to, to narrow focused local programs such as child health, tuberculosis, and dental health. What happens when we fragment public health in this restrictive way? Did this array of public health, environmental pollutions, concerns in the 1960s were addressed independently of the traditional public health system by separate agencies. Because of this restrictive view, when environment pollution concerns arose in the 1960s, they were addressed independently of the traditional public health system by separate agencies. Furthermore, social problems like homelessness, drug abuse, and violence were not thought of as public health problems, despite having obvious adverse health consequences. These, this severe fragmentation led the Institute of Medicine in 1988 to conclude that public health was in disarray, prompting them to the to reaffirm the comprehensive view held by Winslow and Beauchamp. Bringing this to the broader American context, why do these interventions trigger such immediate backlash? Controversy in an individualistic society. The broad view of our scope generate considerable controversy in our individualistic, market-oriented society. The idea that the government has an obligation to provide healthy conditions for unable those unable to provide for themselves or medical care, as most industrialized nations do, is often attacked as socialist in the United States. Conservatives politicians often win election by campaigning against taxes, effectively starving governments of the fund needed for health services. Furthermore, many Americans reflexively oppose being told what to do and resist governmental restriction on their behavior. Ultimately, these debates repeatedly center on three issues: economic impact, individual liberty, and moralism. Let's dive in the first major area of controversy: economic impact. Economic impact, the general resistance. Most public health measures have a negative economic impact on some segment of the populations or industry. Any new regulation is likely to inspire uh, opposition because it might cost jobs, increase the price of a product, and require a tax increase. It might also cut into companies' profits, which is why industries resist change. We saw this historical when milk producers resisted pasteurization. Landlords fought building codes, and automakers resisted safely designed changes. For a classic example of this economic and political conflict, we look to the tobacco industry. Economic impact tobacco industry. Conflicts with a tobacco industry perfectly illustrated the difficulty of dealing with economic impacts. Tobacco is clearly harmful, causing thousands of deaths and millions of dollars in medical costs annually. Yes, it was not until 2009 that political leaders managed to give the FDA the power to regulate the industry. This happened over heavy objection from politicians in tobacco growing states like Kentucky and North Carolina state. Why did it take so long to regulate such a deadly products? Follow the money. Economic impact now, the business and smoking. Tobacco is a major industry supporting jobs and profits, especially in the South. Cigarette sales are also a significant source of income of many small businesses. Owners of bars and restaurants fiercely fought smoking ban, fearing they would lose the patronage of smokers. Politicians are not eager to pass laws with such major economic impacts. Only recently, driven by shifting public opinion and the industry's need to avoid bankrupting lawsuits by injured smokers, have governments taken a serious steps to control smoking. The another economic hurdle is the disconnect between who pays for a regulation and who actually benefits from it. Economic impact. Disconnect between payers and beneficiaries. Controversy frequently arises because those who pay for the public health measures are not the ones who benefits from it. For example, environmental regulations limiting timber harvesting in the Pacific Northwest are attacked because they may cost jobs in the lumber industry. However, those same regulation may preserve jobs in the fishing and tourist industries and contribute to long-term climate stability. Similarly, regulations protecting workers' safety require expensive protective equipment, which drives up the cost of the produced goods for consumers. Furthermore, there is a conflict between timing, paying now versus benefiting later. So, short term cost versus long term benefits. In time of economic difficulty, people are often unwilling to pay short term costs to obtain long term benefits. For instance, fishing and lumber stocks have become dangerously depleted, risking the destruction of these industries altogether. Yes, if you workers in those industries are willing to voluntarily cut back on their own harvest today, companies resist pollution control laws, even though adopting less polluting technology could improve their long term competitiveness in international markets. We see this short uh, when United States auto companies suddenly lose market share during gas price spikes because they invested heavily in uh, profitable but gas guzzling SUVs. Uh, Even when society wants to implement a policy, the math, the math to justify it is incredibly challenging. Calculating cost where benefits. The cost of public health measures are usually much easier to calculate than the benefits. For example, experts might know the exact cost of reducing smog in Los Angeles to cut lung disease deaths by 10%. But how do they calculate if the benefits is worth the cost? It is incredibly difficult to put a dollar value on a human life and health. Furthermore, it is often difficult to quantify what the risk really is and how to balance it against other risks. Consider the complex real world trade offs we face with agriculture pesticides. The pesticides dilemma. People are understandably concerned about farmers using pesticides that may leave toxic residues on fruits and vegetables. Scientists can estimate the average health risk a person faces by consuming these residues. But fruits and vegetables are an important part of healthy diet. If we forbid pesticides, crop yield might drop and produce prices might rise, discouraging people from eating these nutritious food. Therefore, an effort meant to protect health could uh, inadvertently have a negative overall impact on health. Let's transition to our second major source of controversy: individual liberty. Individual liberty is the role of government. In the United States, one of the primary purposes of the government is to promote the general welfare, as called for in the Constitution's. Health, safety, and economic well being are the major factors contributing to this welfare. While the government cannot guarantee health for each individual, its role is to provide maximum health and safety for the community as a whole. One of the central controversies in the extent to which government can and should restrict individual freedom to improve the community's health. Where do we draw the line? Most people agree on restricting freedoms when it involves direct harm, liberty, harming others. There is general agreement that restricting an individual's freedom to behave in ways that cause direct harm to the others is acceptable. The issue becomes much more controversial when the harm being prevented is less direct. The absolute most controversial restrictions are those placed on people's freedom to harm themselves. To understand indirect harm to the community, we use a concept called the tragedy of the commons. A tragedy of the commons. Government restricts behavior causing indirect harm to the others to prevent what Garrett Hardin called the tragedy of commons. Hardin describes a pasture open to all herdsmen in a community. The land can only support a limited number of grazing cattle. If each herdsman tries to maximize his gain by keeping as many cattle as possible in the commons, the pasture will overgrazed. The cattle will starve and the herdsman will be ruined. The only way to save the pasture is the community to agree to restrict the herdsman's freedom, placing fair limits on the number of cattle each can keep. How does this agriculture concept apply to modern public health? In today's industrialized world, the commons comprises the air, water, and other elements of the environment that all people share. Because no individual has the power to control their personal environment independent of their neighbors' behavior. Government's action is required to protect these common resources. While the general principle of protecting the commons is accepted by most citizens, there is plenty of controversy in defining what to include among protected resources and how extensive the protective measure should be. We have made environmental progress, but it comes with constant question regarding freedom. The United States has made great progress over the past 50 years in cleaning up its air and water through federal legislation. Now, questions are being raised about whether laws have gone too far in restricting the freedom to pollute. Companies have been required to limit emission from their smokestacks. The automakers have been required to install emission control devices. While these regulations may have driven up costs, they have not actually limited anybody's personal freedom. Individual liberty restricting self harm. The most controversial public health measures are requirements that restrict people's freedom uh, solely for the purpose of protecting their own health and safety. Classic examples include requirements to wear seat belts when traveling in a car and helmets when riding motorcycle. These are the laws that inspire allusions to the tyranny of health and the health police. Yes, interestingly, restriction on drugs like heroin, cocaine, and historical alcohol have been generally accepted. Uh, let's examine to the philosophical argument against these self-protection laws. Individual liberty, paternalism, and libertarianism. Restricting individual behavior in this way is often criticized as paternalism. Libertarians, the scientist John Stuart Mill argue that power should only be rightfully exercised over someone to prevent harm to the others in conduct concerning merely himself. A person's independence is absolute. The one generally accepted form of paternalism is for children and young people, as they are not mature enough to make considered judgment about their own best interest. This is why laws prevent juveniles uh, from buying tobacco and alcohol and mandate bicycle helmets and seats belts even where adults are exempt. Applying libertarians' principle in reality is often inconsistent and messy. How do public health advocates fundamentally defend defend these restrictions without resorting to strained arguments? Most public health advocates believe there are fundamental justification for restricting behavior for public health. The Beauchamp justification, this scientist Beauchamp argued in The Health of the Republic that laws has most needed for behaviors that are common and carry small individual risk. For example, consistent use of seat belts prevent thousands of deaths, even though the risk people face on any single trip is quite small. While an individual choice to drive unbuckled may seem rational to them, society's interest in preventing thousands of collective deaths outweigh the minor inconvenience of obeying the law. Beauchamp view death and disability as collective problem, requiring, requiring collective action, with pushback against the United States tradition of prioritizing private liberty above all else. Thank you for your attention today for the part one of the chapter two. See you next lecture to the part two of the chapter two. Goodbye.